So a lot of my patients come in with a lot of urgency, frequency, maybe some urinary leakage. A lot of men have urinary issues as well, usually related to the prostate. So things like a weak stream, straining to get to the bathroom, things along those lines. I see a lot of patients with urinary tract infections, but I also see patients with pelvic organ prolapse, stress incontinence, so leakage with laughing, coughing, sneezing. I'll kind of be the first step before they need any sort of procedures or imaging. So I get to meet patients face to face and kind of talk them through that process and what they're about to maybe have done or get imaging for. I think a lot of times it's so easy for a patient to walk in, they're handed a medication, but they don't understand why I'm taking this or why is this even recommended. And so I try and lay out very basic things about why is the bladder acting that way? Why is the prostate causing their symptoms? I use a lot of diagrams. Sometimes I'll pull up videos. I think it's just really useful for the patients to get a better understanding about why things are happening, because I think then they're more prone to follow sort of plans and maybe take the medication and also follow up, because I think that's important too. Urology is kind of embarrassing. A lot of patients are really embarrassed to come and start talking about urination. There's different things going on. They're very sensitive topics. And so I try and make my patients feel as comfortable as possible. It's a very common occurrence. I don't think people understand that. I think they think they're the only ones, and that makes them feel even more ashamed or alone. And so one of the things that we aim for is to try and improve that quality of life.